MU Healthcare, Dr. Fatima Samad. Is that right?
Yes, David.
Thank you so much for being here. So, the physical activity guidelines for Americans, let's summarize those. What did you see when these guidelines came out that you said this is what people should really pay attention to?
Thank you very much for having me over, David. I think I was very excited when I saw these new guidelines. Just to put things in perspectives, 80% of U.S. adults and adolescents are insufficiently active. So I think these were much needed. These are the second edition of the guidelines. The last ones were 10 years ago. And they really highlight the importance of the benefits on our health that we can achieve with a physical activity and exercise. With these guidelines, they have made it easier to actually reach the target for beneficial exercise. And I can summarize them for you.
We will do that. Let me ask you this. By making them easier, is that good or bad? Because sometimes I think when we lower the standards or lower the bars, that we're just giving in to the fact that not a lot of people are meeting what the old ones were.
So I'll tell you, making it easier actually makes it easier. So it's simple things like people should sit less and move more. For example, a lot of us work at the desk. So in between breaks, just even moving from here till you're to the garage or the restrooms, that counts as additional steps. Like parking a little further away from your destination counts into your physical activity. Taking the stairs instead of the escalators or the elevators, they all count. Instead of, the old guidelines said just do 10 minutes of exercise straight out, and a lot of the individuals can't achieve that. So I think this has really made it easier to reach the goal.
One of the things I hear then is a trade-off where it was in the past where you need to get like 10 minutes needs to be the minimum amount. 10 minutes, if it's anything less than that, it's not going to pay off. But one of the things you can do now is say, well, we do compile the benefits. And
Yes.
so if it is like, and I sit here quite a bit, but if I get up a few times when I have an opportunity during news or maybe during a longer program or commercial break, if I get up and move around, that is paying benefits, even if I don't do that for much more than a minute or two.
Yes, and it's all going to add up through the day. Like a lot of our phones actually have step counting. So, just having that app on really encourages you to take those extra steps. And I think that all counts. Every minute just counts to the daily recommended minutes.
Dr. Samad, is there a limit? I mean, is there a number that we should aspire to of total active minutes each day or a week?
Yes. So the guidelines say that for substantial health benefits, adults should at least do 2.5 to 5 hours of moderate intensity activities over the week, or 1 hour to 15 minutes to 2.5 hours of vigorous intensity activity over the week. So I can explain a little bit of what moderate intensity means and what vigorous intensity means. So moderate intensity just means brisk walking. So that would be a speed of like 2.5 to 4 mph. And what does that mean for us on our everyday living? We obviously don't have speedometers attached to us. So it just means you're walking at a pace where you're comfortable talking, but you won't be able to sing. So there's that exertional level. And then vigorous intensity activities would be like running, jogging, like carrying heavy groceries back and forth. And those are vigorous intensity activities. So these are really the goals for the week.
Vigorous activity. Can you do it by heart rate also? Can you? Because a lot of people wear things where they can measure their heart beat pretty easily.
Those are cardio. The guidelines don't specifically have this, but yes, cardio activities can be at a certain threshold for heart rate to burn calories. Yes, you could use that as well.
Do we ever get to a point where we need to continue add on to the exertion level or add on to the repetition or perhaps the resistance if we're doing some weight training in order to get the same benefit?
So yes, and that's great you mentioned it. So these guidelines do highlight on muscle strengthening activities to be implemented in our weekly exercise at least 2 times a week. And they actually add to the benefits that we see from physical activity.
You probably see patients who say, but I'm not going to go to a gym and lift weights. I'm not going to do that. What do you tell them as far as any kind of resistance or weight-bearing training that people might be able to do apart from free weights or weight machines?
So, actually climbing up the hill, taking the stairs are muscle strengthening activities, and there are things that they can do. Even, gardening outside. I mean, right now it's winters.
Sure.
I doubt somebody's able to do that. But heavy gardening, shoveling the snow in this, in these winters, all count to muscle strengthening activities.
So anything that you can use, because I think in my own situation, I would use the legs much more than I use the arms when I think of doing something. Like I might walk, or I might ride my bike, or I might do something that would be more leg-oriented rather than upper body.
So then running actually and dancing, they can, there's certain things, contribute to muscle strengthening.
Are these numbers that you've summarized, are they the same at all age levels, and are they same male and female?
So they're same for males and females. We don't have any discrepancy between that. But as far as age goes, adolescents from 6 to 17 years have different numbers, and they are that they should do at least an hour of moderate to vigorous activities daily. And children like preschoolers from 3 to 5 years of age should do at least 3 hours of a mixed moderate to vigorous activity every day. And that's why there's a lot of stress on our education school system that, students should be physically active throughout. It should not just be limited to the gyms or certain play area. It should just be physical activity throughout the day so that they can achieve that 3-hour goal for preschoolers.
3 hours it seems right now sounds a lot to that, but it used to not be a lot. But right now, I don't know if preschoolers, 10 or 15 minute playtime, but a preschooler, I think, is a lot active. Even in the preschools and daycares, I think they keep them pretty active.
Oh, definitely. I actually have a toddler myself, so I can definitely commit to you that they're pretty active, and they can run around and have a lot of energy.
But then when they get to elementary school and middle school, and if you don't go out for a sport in high school, I think it gets tougher and tougher.
Oh, yes. So it's very important for adolescents because childhood obesity, and we're seeing so much of weight gain and obese children, and that has, long-term really negative impact on their health. So it's very important that we get our adolescents to actually exercising and being physically active.
You're a cardiovascular specialist, right?
Yes, I'm a heart specialist.
So that is the crucial thing as far as when you're looking at people and their activity level. I mean, it has a major impact on our heart health.
Yes.
Anything else you want to say about that?
The physical activity is really key essential to not only cardiovascular health, but overall health. So it improves your cholesterol. It increases the good cholesterol, which we call as the HDL, and decreases the bad cholesterol, which is the LDL. It also reduces, if you have heart disease, and it actually reduces the risk of you dying from heart disease. If you do not have heart disease, it reduces your risk of having heart disease, heart failure, and stroke. It decreases the risk of developing diabetes, and if you're a diabetic, it decreases your blood sugars. It helps with really good weight loss and actually sustaining it with a heart-healthy diet.
Do you give your patients oftentimes a prescription of more activity?
I actually make it a point that I counsel every patient of mine on physical activity as well as heart-healthy diet. You would be, I don't know if you would be surprised, but in Missouri, obesity is at its peak. Almost 1 in every 3 people in Missouri is obese. And then on top of that, 80% of Americans are not achieving their physical activity goals. I think these are very concerning numbers, and we need to really, as healthcare professionals, counsel our patients to do the right things.
Well, I agree with you. It sounds like a smart, and to get up and move, you have to remind yourself sometimes. I mean, it's really easy to sit. Sit is to sit is a job that most of us have mastered. But to get up and move is something we have to remind ourselves to do regularly.
Completely. With our iPhones, iPads, and electronics all over, it just gives us less motivation to be on the move. And with these winters, I tell my patients that even going to a mall or grocery shop and walking in the aisles, little brisk walking, that's what I tell them to do that, because winters can be very disabling if you don't have a gym gym or whatnot.
Good news is you don't have to set aside 30 minutes or 10 minutes at a time. You can do this, but you just have to do it, and you have to add up the minutes. I mean, you don't have to physically add up the minutes, but you just have to know that you're getting minutes of movement in.
Completely agree.
There are the physical activity guidelines for Americans. You can do a website search or just do a search, for physical activity guidelines, and you could get those summarized. I've got a good summary right now here from the what's AHA journals, American Heart Association journal, is a really good one there. Well, Doctor, a pleasure to meet you. I hope that we take into account what you have said and live healthier lives. So thank you.
Thank you very much.
Dr. Samad from the MU Healthcare has been our guest. You're listening to KFRU.